Hello, everyone. So it's with great pleasure that we invite another INI SS topper in the recently concluded INI exam. We have Dr. Sumit with us. I am Dr. Riddhi, the critical care faculty for Marrow, and we welcome Dr. Sumit, who has secured rank 4 in the recently concluded INI SS in the critical care specialty. So, welcome, Dr. Sumit, and huge congratulations from me as well as from the entire Marrow family for your success. Um, and for
Yes,
getting
thank you, sir. Thank you very much.
yeah so because the viewers would want to know a bit about yourself, about your basic medical training, and why did you decide to choose critical care as your specialty in terms of further studies.
So, yeah, hello everyone. Myself Sumit. I did my undergraduation from Government Medical College, Gadag, and currently I'm doing my MD in anesthesiology at AIMS, New Delhi. So, sir, right from the beginning, after taking anesthesia, I was pretty much sure that I want to pursue critical care after my MD. And during my training, also during the ICU postings, I further developed interest in critical care. So, yeah, I was pretty much sure from starting only that I want to take up critical care after my MD.
Right. And Dr. Sumit, I think you have done your MD from All India Institute in Delhi, right?
So, yes, sir, I'm currently doing it. I haven't given my exams. Theories are over, and I'm still practicals are left, sir.
Oh, okay. So all the best with your practicals as well. I'm pretty sure you're going to pass it with flying colors. So and obviously I have also done my MD from the same institute. So nowadays during MDs you are rotated through all the ICUs, or is it just the AB8 ICU and the trauma center?
No, sir. Actually, now we have apart from ABAT and trauma ICU, we have burns ICU and there's one surgical block ICU also. So we
Okay,
have total 6 months of ICU posting and 1 month in ABAT and 2 months in burns, and 2 months in trauma and 1 month in surgical block. So total 6 months of ICU postings we have.
so I think that's quite extensive. And if for somebody who is interested in critical care, if you're working in the ICU for that long, that kind of fuels your interest going
Yes,
forward.
sir. Yes, sir. Yes, sir.
So,
During my yes,
yeah, go ahead, go ahead.
during the ICU, I used to like we used to attend rounds. Our seniors used to teach us. So I felt the questions which came in the exam, few of the questions were directly from the things we discussed in the rounds. We used to learn from our seniors. So many of the things came directly from there. So it is very useful, the ICU postings.
Right. So and then now you have chosen critical care and you got rank 4. So which institute are you planning to pursue in terms of your specialty?
So my first choice was obviously AIMS Delhi, but this time there are only 3 seats here in Delhi, so I might not get it. So my next second choice would be AIMS Jodhpur, sir. I've spoken to my seniors in AIMS Jodhpur, and they've told me the department and of critical care there is also good. So I'll take AIMS Jodhpur.
Great, great. Um, so now coming back to your preparation strategy, right? Because you're just doing your MD and you've not even completed your MD. So it's quite commendable that you actually got such a good rank while balancing your MD anesthesia curriculum as well as your exams. So what was your preparation strategy and how did Marrow help you in terms of your preparation?
So, sir, during my residency, as you know, we have 6 months of ICU posting. So, I used to read during my posting. I used to read critical care from books like Paul Marino and Washington Manual. So, I read those books during my ICU postings. Coming to the actual preparation, sir, I had decided that I'll start my preparation in my final year, like in fifth sem. But fifth sem went in thesis writing and submitting my thesis. So I could not read critical care in my fifth sem. So once my thesis was done in July, so post July, I started my actual preparation. And I think 3 to 4 months I would have read only critical care, sir, till October. So for that, my primary source was the textbook only, Washington Manual and Paul Marino, which I had read previously. And so Marrow, actually, honestly, I didn't know that there is a Marrow critical care program until very late. I got to know from my batchmates and few of my colleagues that there is a Marrow critical care program and you are taking it. And you being an alumni of AIMS Delhi, so I was like, I should take up the program, and so I took the Marrow course very late, so I didn't have the time to make the notes. So I just watched the videos, that too in 2x speed, but I could watch the videos twice. So that was pretty good enough for me, like to get to know the topics. Rest also things, and also I would like to say ki seeing the paper this time, I felt that there was pretty much good amount of portion from anesthesia also. So anyone preparing for critical care, especially INI, they should read their anesthesia also like thoroughly, because there were questions from pain, regional, obstetrics. So it's not just critical care. There are questions like 15-20 questions from general anesthesia also. So you should know your anesthesia also properly.
Okay, so that is a very interesting thing that you mentioned, because like people who are basically aspiring for critical care, not everybody might have an anesthesia background, right? Like you are lucky to have the anesthesia background, probably give you an edge in those questions. So if I were to ask you, like what kind of anesthesia questions are being asked? Are they like core anesthesia questions or questions that kind of overlap with the critical care portion? Because like if somebody is
So
asked politics or things like that, it's probably not fair for the aspirants, right? So that's why I was curious as to what kind of questions are they asking.
few questions are like, sir, from core anesthesia, like which we practice in our OT. Things like putting a DLT, size of DLT tube. So which an anesthetist only will know. So things like that. Then regional anesthesia, there were questions about blocks, blocks like such as adductor canal block. So those things people from general medicine might not know. So especially in case I don't know what NEET, how is the pattern of the paper, but in INI I felt that there were questions from anesthesia also, and like pretty good amount of them were there.
Okay, so I think that one of the reasons for that is AV8 is making the questions for INISS, right?
Yeah, yes, sir. I think so.
But I personally feel that it is a bit unfair that you're asking. Like I'm okay with people asking anesthesia questions related to critical care, but asking somebody about erector canal block for somebody who's going to work in the ICU is probably not fair. But anyways, so that is the pattern, and then you have to go with it. Whatever questions they're asking, it's not something that you can change or complain about. But that was very insightful. So in terms of like you also mentioned about the Marrow videos and you watched it at 2x speed. So I think that is a very good strategy because anyways our time is whenever you watch the videos, even if you're watching a YouTube video or something, I think that is something which all the aspirants should remember that you should try to watch it at a faster speed. And I don't know, obviously you didn't get time to make notes as you said because you started preparing very late. But I also advocate everybody to make their own notes rather than depending on the Marrow notes because that kind of tends to reinforce the same knowledge in your
Yes,
brain.
sir. I didn't
And
have time, so that's I couldn't make. But I would suggest people who have time, who have taken the course early, so they can make notes.
And were the Marrow videos helpful in terms of your building up your critical care knowledge as well as in terms of your
Yes, sir. It was. I found it. I found it very helpful. There were questions actually from your videos, questions on ventilation, mechanical ventilation, hydrocortisone, and sepsis. So there were directly questions from your note, like videos. So I found it very helpful, sir.
right? So because most of the videos that I basically put up is basically not exactly MD level videos. They're slightly ahead because those were the things that we basically discussed during our DM curriculum. And the entire point
Yes.
of putting those videos was that not just for the exam, obviously for the exam, that is one of the purposes, but also so that people who are interested in critical care, even if they're doing some residency, they can actually get an insight into what is evidence, what is the latest evidence in each of these topics, so that they can actually improve their practice, even if they don't have a good curriculum in their whatever hospital that they're pursuing their residency or IDCCM, DM, or DRNB. So that was kind of what I personally try to do in the videos. And for aspirants, like for future aspirants, obviously you kind of balanced everything. So in a way, you are kind of an outlier because preparing for MD as well as giving a NEET INI super specialty and getting a rank is not that easy. So, but for future aspirants, if you had more time, or what would you think is the ideal strategy for such exams, or how you would advise somebody who is maybe appearing for the next INI SS or for the NEET SS or for whatever exam trying to pursue critical care as a specialty?
Yes, sir. Sir, I would suggest first key utilize your IC postings. I would suggest key read books, standard books like Washington Manual and Paul Marino. Both are good. So read those books during IC postings, and uh, so if you have read them once, you'll be thorough with your basics. Yes, and you can take up the Marrow course. The videos are very like precise and to the point, and they cover almost everything that is being asked in the exam. So that is also very helpful. So basically, that's also books like Paul Marino, Washington, Marrow videos. I think that's enough for INISS.
And Are there things that we can improve on in terms of what Marrow has to offer? Things you found maybe we are a bit deficient in, and maybe going forward we can improve for all the people who are subscribing to Marrow for critical care?
So I didn't find any like anything lacking in the videos which you had taught. So I found it very useful, and I think that should be enough. The amount of topics you have covered and the depth in which you have gone, that is, I think, sufficient for the exam.
Thank you, Dr. Sumit, once again. It was really insightful talking to you. And the last question I would want to ask is, because NISS again is a two-stage exam, right? So
Yes.
did you prepare any differently in terms of the stage 2?
Sir,
Is it
we
just
have
spontaneous?
senior. We have seniors, so I had asked my seniors so how the interview is being done. So they had suggested ki like there will be stations and you'll be asked different topics. So I prepared according to that, sir, as told by my seniors.
Yeah, so in a way you had some in-house, what do I say, some benefit of being in-house. But again, I think AVIT is doing the same exam since when I joined. I was the first
Yes.
batch, 2016.
Yes, sir.
They haven't changed the format at all. They're just doing
Yes,
the
sir.
same format. So
Yes, sir.
I think like it's an open secret anyways. So
Yes.
congratulations, Dr. Sumit, once again
Yes.
from Marrow, for your wonderful result. And I wish you all the best for your upcoming practical exams as well.
Thank you, sir.
It has, I don't know whether they still follow that tradition, but usually we will have a pass out party the day you pass the exam.
Yes, we have, sir. We have the same night.
So if you ask your seniors, they would know we had some of these wildest pass out parties on the days we would pass the exam. And I
So we
really
have party the day we give up the practical exam, and then once the result comes, then also we have.
yes, exactly. No, I'm not talking about the later one, the official one. I'm
Yes,
talking
sir.
about the day you pass the exam, right?
Yeah, it's still going on, sir. Still
So
the
I hope
tradition.
it's still there, because I was one of those who would ensure that the parties would happen. So I sincerely hope that the tradition is going on. And
Yes, sir. It is going on, sir.
great. And I wish you all the best for your practical exams.
Thank you,
And
sir. I would hope to meet you sometime in future, sir.
yeah, feel free to contact me. You can get my number from any of your seniors. Priyankar, anybody actually, everybody almost has
Yes,
my
sir.
number. So you can get the number from me, and if you need any help, I'll be happy to guide you. And I
Thank you.
hope to meet you sometime in future in some conference, maybe in AIMS or somewhere else. And I wish you all the best. Thank you again for.
Thank you. Thank you for having me.